Hi, I'm Dr. Blair Masters with Arkansas Physical Health and Rehab, and today we're going to be talking about lumbar radiculopathy, which is a big word for sciatic nerve pain. And this is that pain going down the leg that can just be really debilitating. We're going to be talking about the causes of it and how we treat this condition here at the office. So let me give you a little bit of information on sciatic nerve pain and how it works. This is the spinal cord, and when these nerves become inflamed, going to anywhere in the body can cause problems, but here it shows the sciatic nerves coming out from the spine, going down the legs, and when you have this, it can keep you from working, it can keep you from enjoying your daily activities, it can really be devastating. Let's talk about why this usually occurs though. Here's the disc. The rings around the outside can become weak and frail or just torn, and then that allows the disc to bulge out and pinch on this sciatic nerve. This isn't the sciatic nerve here, but this goes out and forms the sciatic nerve. And when it pinches on that, it can be a real problem, but there's some other things that can cause problems on top of that, and that is degenerative disc disease. When the discs degenerate, they come closer together, and that can make it more likely to pinch on the nerve. Now, a lot of times the herniated disc and the degenerative disc go together, and they also, to make it even worse, you get spinal stenosis in some cases. And that's when the bones start to actually grow into the hole where the nerve comes out and start to encroach on that and make it harder and harder and harder to fix the longer you wait and put up with the pain. So disc degeneration is something that is extremely common, and what makes it worse is oftentimes disc bulges, herniations, and disc degeneration go together. So it makes it harder to fix. So when we see that sort of thing, it can pinch on the nerve with the degeneration by itself, or if the disc is bulging along with the degeneration, it can also pinch on the nerve. Now, we're going to be showing several different levels of where the nerves are pinched and what that looks like in a pain pattern, and pay attention here and see if you can recognize yourself in any of these areas. So when L2 is pinched, it tends to come around the front of the hip like so. That's a very common one. L3 comes around but in a lower pattern and goes down the leg more. L4 tends to be more back and down across the hip and around the front of the leg. And then L5, this is where we get into the classic sciatic nerve pain. Really goes down the back and along the outside of the leg more. And then S1 is also something that goes down almost the direct back of the leg. You can see the pain pattern coming right straight down there. And many times you'll have these together. Maybe your pain has gotten bad enough to where you're even considering surgery. That's pretty severe, but people in pain are desperate. And before you take that step, I'd really like you to give us a call here at Arkansas Physical Health and Rehab. We have the techniques, we have the equipment, we have the technology, and we have the doctors who have experience that can help you, whether it's a bulging or herniated disc, disc degeneration, sciatic nerve pain, whatever your problem is, it is worth your time to come in and consult with the doctors and find out if we can help.